Hi, everyone. Today, me and Elyse, Rayanna and Elyse, are going to be talking about the diagnostic process for ADHD and autism. So, sharing a little bit about our stories and some clinical experience we have with diagnosing and how it might present differently across gender and things like that. So, yeah.
So Rihanna introduced me. Um, my name is Elyse, and I'm going to talk about my personal experience with being diagnosed with ADHD and autism. So I was not diagnosed with ADHD until I was 29. I had been told throughout my life by a lot of people, including people that worked in the mental health field that I was friends with, like, I think you have ADHD. You might want to get that checked. And I was like, necessarily, if I have it, it's not like really bothering me enough to do anything about it. I'm like, oh, it's fine. I wasn't very self-aware. And then during the pandemic, I was really forced into self-awareness because I couldn't go anywhere. I had to spend a lot of time by myself. And then I started, becoming very burnout. And I was like, oh, I'd really like to check on this ADHD thing, because maybe that's what's causing my difficulties. And the more I looked into it, I was like, okay, like I have a family history of it. I seem to match these symptoms, and these are disruptive symptoms to my life. Now that I was an adult, and in school there was more structure, but like in my adult life, I was having a lot of problems with organization. So I went to my family practitioner, and she referred me to a psychiatrist. And I was lucky that it was a female psychiatrist because I think that not to be, I think you can go to a man or woman, but for me, I liked going to a woman because I thought there's more of a chance she might know more about how this presents in women because I had heard it that it presented differently. And she did a screening where she kind of assessed me. It was pretty quick because she could probably tell by my intake, which is very long. I feel like ADHD people, we tend to write very long and like give every kind of explanation. So I feel like that probably gave me away. And I had a lot of different hobbies and studies on already. So she's like, oh, that might have clued her in. And then she heard me talking and like pretty soon, and she's like, you have moderate to severe ADHD. And then I was worried about asking for Adderall, but she offered it. I don't think you should be nervous about asking. There is a bit of a stigma, but it's a medication and you want to be honest. And the doctor might be like, oh, I want you to try a non-stimulant, or like, let's try ADHD. For me, she said ADHD, you can Adderall. But you can always get a second opinion if you're not, you want a different, if you want to get a second, sorry, I'm like doubling it, but if you want to get a second opinion.
Mhm.
And that is it wasn't too scary. It was more scary in the beginning because I wasn't sure what was going to happen. And because I was an adult, I didn't want to be accused of being someone that was trying to take Adderall for, illegal purposes.
Yeah. They,
Yeah,
they have such a push with the prescriptions for Adderall, like
yeah,
trying to keep it controlled. It's a
yeah.
controlled substance. So I get why they would. It definitely
There's so many
is
holds
an
on
intense
it.
drug.
Yeah.
Yeah.
And it is abuse. Like I definitely in college, saw it happen. Um,
Yeah.
I feel like, there might be some people with some biases, but, always get a second opinion if you feel uncomfortable. And I feel like knowing
We
that
talked
most,
last week about the medication, so they could always like see that.
oh yeah.
Yeah.
So we'll put that in the description, the experience about like actually being on the medication. Um, and after that, it, wasn't too bad. I did a lot of research on my own though, so I'd recommend if you get a diagnosis, like,
So how did you get to the autism?
oh, the autism. Okay, so this is interesting, and I didn't know this until I met other women with autism through this coaching training program that I took. But frequently, women with ADHD and autism are diagnosed with ADHD first, and then once they're on the Adderall and their ADHD symptoms are more controlled, they start noticing the autism symptoms. So I feel like for me, like I had been so distracted by my ADHD symptoms, that I didn't recognize my autistic symptoms. And then I also met other women with autism, and I was like, oh, I seem very similar to them. So I went to my psychologist, and you have to go to a psychologist to get diagnosed and screened with autism. And he gave me um, a 60 question assessment. You might know what that is. Um, and he said, okay, like you have autism, but again, like didn't give me a lot of information about it. I had to look that up on my own.
Mhm.
So in both cases, like I had to do my own research, which I encourage you to do as well. But it wasn't that hard. I will say that in both cases, I probably would have had to bring it up myself, because they assume by the time you're an adult, they're like, ah, she must have been diagnosed in childhood, or like
Yeah.
she would have been diagnosed. But like when I brought it up and I was like, I think I have ADHD, or like I should get assessed for autism, like
Mhm.
they checked for it and I had it. But I feel like you do have to be proactive as an adult to ask to be assessed.
Yeah, definitely. And
Yeah,
I think there's some validity to that because it's not exact unless you're seeing a therapist and they
yeah,
like are in a situation where they can tell you like what they think is diagnostically wrong with you. It might not be appropriate for your physician to just
yeah,
be handing out diagnoses just because of their um impressions without
yeah.
like, following through on some stuff. So my journey was a bit different. So I was when I was around like 16, I was in an outpatient um group therapy setting. And there was a psychologist or psychiatrist there that we all like saw for short periods, like a 10-minute kind of talk. And I kind of explained my symptoms. He told me it was anxiety and depression, and he put me on a non-stimulant medication, Strattera. And when I went back to my family doctor, I talked with her about what had been going on at the outpatient. So what the psychiatrist had told me and the prescription, and she was the one that gave me my Adderall prescription. But I didn't use it in high school and or college. So I don't think I went to go get the prescription until I had started working in psychology. I'd started working in an inpatient like residential for adolescents, so it was a bit of a full circle there. And I just kind of knew I had ADHD, I guess, the whole time. I didn't really think anything of it. I just thought it meant that I was like hyperactive because I was hyperactive. I had a lot of attention. I could get distracted. Like I didn't really think of it has how it affected like any other aspect of my life. I just thought I was kind of like a bit odd and just had like a lot of different interests. My sleep patterns were always different than like the norm, but in my family, it was somewhat the norm. Everybody had their own like now I understand it to be like ADHD type symptom. So just a bunch of characters in the house. And I didn't really see it as something to color in the other areas of my life because I still thought that, okay, maybe I am like a tendency towards depression. Maybe that is like some truth. Like maybe I am very anxious underneath. Like I didn't really feel like they fit, but I felt like, okay, maybe I do go between these two points. Of course, we all go through anxieties and depression, but I just felt like my moods shifted in a different way. Um, and then it wasn't until I was in my clinical program where it was virtual the first year. So I spent a lot of time on the computer and it was so hard to like focus on any course. I was also doing all my little side projects. I'm part of a nonprofit in Belize. It's Rhythm of Change. Just have to plug that. But I was also doing a lot of work there. I was doing other little side projects. I wanted to like work with someone that I'd known from my hometown on their projects. I was just all over the place. And it wasn't until like my first semester that like I got two B
Yeah.
minuses and they sent me to like a little court hearing with all of the professors. There were like seven of them. It was a little, I wasn't sure because I thought you could get B,
Intimidating.
I thought, B's get degrees. But no, they were, worried that maybe I wasn't taking the time for the program. And I don't think I really even understood what I was getting myself into, that this was going to be like a full life consumption. So
We tend to
it was,
like to split
yeah.
ourselves into lots of little
Yeah.
areas and like,
So yeah, I went to that meeting and basically the only way I could kind of explain myself was through the ADHD, even though I hadn't personally like taking it, but I knew that I couldn't sit on the computer
yeah.
and just focus on like what somebody was saying. And everyone else was so still. And I was like literally like I don't know, like seething in my chair. Like I could not stay still. I really saw it on the screen that everybody else was still, and I was just like, oh, it's like moving around. Anyway, so they wanted me to get on medication. Like that was part of like, okay, go see a therapist, work on your symptoms. And I really didn't, I have always had that since I got it from my family doctor, the Adderall prescription, but same thing we talked about in the last video. I kind of took it whenever as needed. Um, and it wasn't until I worked my third year practicum at ADHD and autism and neurodivergence and learning disorders, memory. It was like all inclusive neuro assessment site. But I was primarily working with ADHD and autism in kids. I realized like, okay, wow, am I autistic? Because the symptom overlap is very, very
Yeah.
similar. So a lot of the things, especially as a kid, that I thought was just like very nuanced to me and like a little odd, these kids were doing it. And I was like, wow, like I was a, now I understand it from a clinical lens, like everything that made me feel like the anxiety and depression symptoms was really like an offset of having this neurodivergence and trying to assimilate always to a culture and like world that wasn't fit for my brain. And it really like came in like waves of realization that like, oh, I don't have like clinical depression. I'm not like anxious because I don't actually feel worry for the future. I just can't stop moving.
Yeah.
I want to like when I get up and I want to move, I like want to move. And it seems like an anxious decision, but really it's like my brain's just wanting me to divert my attention and kind of walk into a new setting and find some niche environment and activity to do to keep myself
The dopamine. I feel like
that
your
dopamine
experience
hit.
is like I got given anxiety first, and I had that related to ADHD, but most women get a misdiagnosis of an ADHD or depression instead of before they receive at least one wrong diagnosis before they receive ADHD
Yeah.
because of the stigma. And I also think it's interesting that, like, yeah, in our families, our parents don't really notice anything's unusual about us because women, we tend to be more quiet and mask better at school, but like at home, like our families are probably also neurodivergent, even if they're unaware of it. So it doesn't seem abnormal to our parents because that's how their families were. And then we tend to, I notice a lot of my friends were drawn growing up that were probably neurodivergent. So we're like, this is, I see other people like this. Maybe not the majority is like this, but you kind of just, see your parents like get along with it. And you're like, okay, like that's normal. You don't realize you're having more difficulty.
Hmm.
And it's kind of interesting for you with like the children. What did you kind of notice with the difference between the diagnostic process between the boys and the girls?
So it was their literature and statistics kind of show a higher diagnostic um, compatibility for males in general. Initially, when autism came around, it was viewed as like a male disorder,
Mhm.
that it was primarily something that men suffered from. And like the root of it is autism comes from like the idea that you're very self-absorbed.
Yeah,
You just have such a heightened sensitivity to the world that it's hard for you to imagine anyone else because your senses are already like you have a larger circle of like awareness around you. Your presence is a little more grounded. Those are all kind of characteristics of like a stoic man or like a very, it's okay to be self-absorbed if
yeah,
you're a man. And it's very clear when you are because they don't even try and not to say, but there's a lot less pleasantries. They're not
yeah,
trying to assimilate to the culture. And I think the bigger thing with women and having like read some research on like their prenatal development, they're pre-wired to need and connect and want to develop social connections. So there's a lot more pressure for them to assimilate to the culture and recognize because socially they're around other people and they know that they're different and they're like watching other people in a way that isn't traditionally an autistic characteristic. I think when you think of autism in children, a lot of it is kind of individual play, like parallel play, like they're not totally engaged with someone else. They're okay going off on their own, doing their own things. They have very special interests. They love whatever they're interested in to like a uh, almost diagnostic
Yeah.
level, right? Like a disordered level, like that's all they think about. So it is like a very powerful way to live, but it's not normal.
Yeah.
Um, Whereas girls, although they'll have that same kind of desire for alone time, they're kind of pre-wired to read faces. So they're already kind of looking at faces, even though maybe eye contact is uncomfortable, but they're recognizing like different facial expressions, emotions. So they learn how to mask in a very skillful way because they can literally, okay, my mouth should go like this and my face should go like this. And, they'll find ways to avoid eye contact, but they'll stay, there's a different, we teach little girls and boys to be different already. So then there's a lot of internal suffering
Yeah.
with girls. They're very creative, but they have a rich internal world. I mean, both genders do, but um, it kind of leads to that anxiety and depression. Whereas maybe a male is, okay, this male is autistic, like we understand what that looks like. It's very standard, as opposed to like a female being autistic, but still like looking for social interactions, just needing to do it a little differently. Um, yeah, so it's a different in socialization, but in infancy, the symptoms are the same. And then, yeah, it's the child kind of socialization that really changes things.
Yeah. And ADHD women also mask and are very more internalized presentation as well.
Mhm.
So it's like because we're more socialized to kind of hide those differences. And you can see, I think I saw a study come out recently that um, I think for life expectancy, men with ADHD have like a 6 year, 6.5 year negative impact. So they'll live 6 years less than the average man. But like women with ADHD will live on average 8 to 8.5 years less than the average woman because of the higher rate of like autoimmune and like internalizing those emotions. So it really like does affect our population in like a very negative way. And we did an interesting video on masking, which I'll put in the link. But Rihanna, for you, like, what would be the most important thing to note for a woman? Like, what would you recommend for a woman or a girl that's like that's interested in being diagnosed? Like, what are,
I think that there's a few different things. But I think even though I am in the realm of psychology and I do believe in the benefit of being diagnosed, I think that there's also an element of like self-understanding that um, you can kind of understand yourself through a lens without needing the diagnosis. And as an adult, there's not like particularly a lot of like medical need. I mean, maybe that's not right to say, but I think there's a lot of stigma around like seeking diagnoses. I think as a on the other end of things, like on the diagnostic end, if someone comes in saying they have something, it's hard, right? Like you know yourself, and this is
yeah,
like what you've done research online. But coming into a professional setting, there's a little bit of like, okay, why are they coming in? Like, what is the need for this? I think with ADHD, it's always like kind of like, oh, they're looking for an Adderall prescription. But I think in my experience with being ADHD and also where I recognize ADHD in someone else, it's kind of very clear. It's just something that you've always known. I think when I was testing kids, especially, it was like one of the earlier questions that I asked, like, do you know what you're doing here and how does your brain work? Do you think your brain works like differently? And the kids who did have neurodivergence, they were very aware that like, yeah, I think I I recognize at whatever stage of development they were that yeah, I think I do things a little differently. And so that self-awareness to know that you can go into some of the research and feel like, okay, this really makes sense to me. And it connects to who I am, and I can feel that, and recognizing like that can be enough. You don't always need to
Yeah,
seek the external validation of a diagnosis because you're not going to get medication for autism. And it honestly can be, unless you can find it through insurance, it can be a pricey endeavor. And maybe
yeah,
there's, can you be a part of that community and maybe still connect to resources without the formal diagnosis? Yes. And I don't think you should like hold your whole identity on any diagnosis that anyone gives you. No one really
yeah,
knows you more than you know yourself. Not to discredit like the importance of diagnostic processes, but it's not, because we face different stigmas as women, like looking for a female uh, to test, or like someone in the ADHD autism realm, because they tend to, when I talk to someone, I can kind of always like pick up like, oh, this person's a little like
yeah.
nerd, just
We can
the
always tell.
way
There's
they
a
use their
sense. You're like, oh,
hand
okay, like,
kind of comes out, right? So I think if you are thinking that you have it, and you want to talk to your physician, yes, if they want to like refer you to a psychologist or psychology department, that's great. I think there's also another avenue of like maybe you should engage in a little of the community and see if like these are your
yeah,
people. See if you connect to the things that they're saying. Like sometimes I talk to my friends about like ADHD symptoms. I went to like a triathlon. I forgot my shoes.
I remember that.
And so I had to like borrow someone's shoes. And so a girl like saved the day, and I ran the whole thing in her shoes, which was very
That's
funny.
very
And
impressive. You're like, I want to do it, and then you just
but
did
I
it.
was with a friend who definitely like has some symptoms, and it was just one of those like, oh, I would have done the same thing. Like I totally get how you could space on
Yeah,
like the important part of going somewhere, you know? But yeah, so sometimes the external validation you need is a sense of belonging within a community and not a diagnosis. That being said, like I mentioned, going to a physician, sharing concerns. And for adults, it's like you said, the interview process, it's kind of like a long questionnaire where they ask you what your symptoms look like in childhood, because it is neurodivergent. So it happened in developmental years. So this is the way your brain developed. This is not something that comes on at any point. It's very genetic based. Like this is like destined for you. So these symptoms would have always been present. And we often ask for like parents or grandparents, someone who was around to see you in
yeah,
infancy. Um, and so how your symptoms kind of presented as a child and how they present now. And that's very interesting on the diagnostic end because you get to hear how people have learned to mask. Like, okay, I used to do this, but then I learned to do this. And so I do that instead. And they set it as like little rules. So you'll also see an overlap of OCD in
oh yeah.
this
There's overlap
neurodivergent.
in both ADHD
Yeah.
and OCD.
Other neuro overlaps, like diagnoses wise, like misdiagnoses, there's bipolar, borderlines. Or you can always co-occur, but a lot of times like this, the ADHD like moods, motivations,
Yeah,
like can be seen as like a kind of
manic
a
episode.
manic
Yeah,
episode. It's just so productive. I could do so many things in a day, and then some days I like can't get it going.
yeah.
You know, so and it also cycles in with being a woman. So PMS, I think you could probably talk about
Oh yeah,
like
I have but yeah,
PMS.
PMDD is
Yeah.
highly comorbid with ADHD and autism, but with PMDD, people frequently think it's also borderline personality disorder or bipolar disorder. So there's a
Hmm.
misdiagnosis around that too. And for me,
Do you want
like,
to talk about like your symptoms that
yeah,
you
oh, with PMDD,
recognize? Hmm.
for me, with PMDD, and I had a
Or
diagnosis.
just like say the full word for people who don't
Oh, premenstrual dysphoric disorder. So yeah, it looks like it could be bipolar because you're okay for 2 weeks and then for up to 2 weeks. For me, like I only get 2 weeks if I'm not taking care of myself. Usually it's around 3 to 4 days. But like, yeah, I get really massive mood fluctuations where I'll be like irrationally, uncomfortably angry. Or like really, really depressed where I can't get out of bed. And like I can see how, and then once I get my period, I go back to normal. but I can see how someone could be like, oh, that looks like you're having manic and depressive episodes every month. And
Mhm.
a lot of women do get misdiagnosed with bipolar disorder because they're like, oh, you're having, even I think my psychiatrist at the time questioned it. And so
Mhm.
I was like, yeah, but it goes away after my menstrual cycle. And I think if you are a woman with autism, you are up to 90% more likely to have PMDD. And if you have ADHD and you're a woman, it's like up to 50% or like 46 to 50. So I feel
Yeah.
like what you mentioned is important because if you realize, okay, I might have ADHD or autism, and I think that self-diagnosis is valid, especially because, yeah, in different areas, like it could cost $2,000 to get a diagnosis of either. And it's like really about community connection. And I feel like for most communities, self-diagnosis is valid. Maybe some, people in there are weird, but most people are not. But yeah, you want to see like, okay, do I have, especially if you're a woman, like, do I have PMDD? Because yeah, you're pretty at high risk for it if you do have ADHD or autism. And that's always good to know because before I really knew that I had PMDD, I just said I had very severe PMS and I had to track it. And I would be like making like I would destroy relationships and like I would destroy things in my life for like 3 or 4 days and then be like, oh, and then I had to clean it up the rest of the month. And once
Mhm.
I feel like the self-awareness factor, like leaving out the medication, the self-awareness factor of like, oh, I have ADHD or autism or PMDD or like any co-occurring thing,
Mhm.
because they both have high comorbidities. Like you can, advocate for yourself better. So that's like a huge advantage as well.
Um, I did want to go over more on the gender variance
Oh yeah.
because there's a lot of really interesting research about gender fluid, non-binary, transgendered
Yeah.
individuals, primarily like on the non-binary end,
Yeah.
with autism, like a very high percentage. And I was looking because I have a
Yeah.
paper. I want to like give the
I just
right.
like to know because it's like statistically, there's some interesting statistics on
Yeah,
that.
it's like a third or something around that. Um, But anyway, just the co-occurrence of gender dysphoria, as we understand it, gender variance, um, and autism because of the kind of innate lack of social
Yeah.
norms. Like you don't really get why people would do things if it's not the most efficient, effective way. You're so wearing a dress or not wearing a dress, I mean, it's not about a feminine versus masculine. It's about, well, do I feel like this is a comfortable thing for me to wear? Like this is more efficient because I get more breeze,
Yeah.
or like it's just much more analytically just kind of gone over than maybe a gender or a neurotypical person.
Mhm.
So already those lines are really blurred. Like you don't really even know how
Yeah.
to act like a man or act like a woman because it's hard for you to pick up on what everybody else is doing.
Confused.
You're kind of consumed with your own stuff. So there's a higher comorbidity because you're already on the fringes of your own gender. So it does feel like welcome that like I actually don't feel so attached to either gender. And then there's also an element of like, do I even feel a high sexual drive?
Yeah.
Like I can sustain without it. Because I'm not really, that's not the stimulation that I'm
Yeah.
searching for in my life.
Asexuality is higher
Yeah,
in yeah.
asexuality, just like you're already so consumed. Like
Yeah.
I have so many side projects in my life. I could like
I
just
think
keep
yeah,
doing all of
I
my
feel
own
the same
little
way where I'm
things.
like my side projects are like uh yeah, it's like such a key. People are like, how do you keep yourself entertained? Like we
The
can keep
dopamine hit.
ourselves so entertained with our own internal thought process and our like
Yeah,
projects. But like we could endlessly find ways to entertain ourselves.
yeah. So so that's also like a very interesting kind of overlap. I wanted to see what else do we like some other comorbidities. So definitely with ADHD in boys, like the ADHD difference, you see a lot more of the ADHD is kind of characterized as either inattentive or hyperactive. And then you get the combined type. I think I like to fall into the combined type because I can
Yeah.
definitely, but girls tend to get diagnosed with the inattentive because they tend to be aloof, like they're the social butterflies, but they're kind of always like staring off in like a longing way. Um, Whereas the hyperactive girls would probably be more on the behavioral end. And because girls tend to already be submissed, they will kind of adapt to the inattentive, whereas boys will have like a high morbidity of like conduct disorder. They'll get into fights, they'll call out, they'll be like way more physically hyperactive. They'll have a ton of energy to kind of keep the party going. And they have a lot of, if they're the social butterflies, men can
Yeah.
hold social attention a little differently than girls. Um, so that's another thing to really consider, like why men would die earlier with ADHD, because they're just like
I know it's like
really
accidents
searching
is
for
also one of our
movement.
risks. Like taking ADHD medication reduced our death rate because of the like we also are more risk for dying from like freak accidents. And I'm like,
Yeah.
that makes sense. Yeah.
Yeah, there's like the funny little things of like, because I didn't really understand that it was a brain thing, like an organic thing, until I started working in that setting. I thought it was like a mental disorder, but it's actually more in like a neurological
Yeah.
disorder. So it's different. So it's like your whole body is created in a different way. You feel things
Yeah.
differently, you digest food differently. Like it's just a different,
Oh, the physical comorbidities with
the physical, yeah. So some of that, and again, I have this like paper up that could, because you're like internalizing a
yeah.
lot of your stress. So you have a lot more internal um, physiological differences. I have this paper,
No
but
hypermobility, like Ehlers-Danlos.
mm, I think this is the final one.
Yeah. So you've done a lot of research on this.
Yeah, because I was so fascinated when I was working there, and then I was working with a non-binary client that it took a while to like figure out their diagnoses, even though I'd seen them for so long and I was working in these different settings. I'm still a student, but a lot of things like we were talking about the bipolar when I first was meeting with them. They, a significant depression, and then we had kind of a week or two of like something like shot up their interest, and they were so productive in a way that I hadn't expected them to be able to be because of the depression. But they were just like very, and I was like, oh wow, like almost manic-y. But as we progressed, we found the ADHD and autism were like a better match. So let me see. So females with ADHD, if you don't mind, if I
Oh,
can
yeah,
kind of
for sure.
go through some data. So females with ADHD are more likely than their male counterparts to show inattentive and disorganization as a predominant presentations, experience internalizing and emotional regulation problems, be it a higher risk of cigarette smoking in adolescence, there's a lot of oral fixation, be it a higher risk of developing anxiety, depression, bipolar disorder, or personality disorders in adulthood, show a trend for greater morbidity by both natural and unnatural causes. Males with ADHD are more likely than their female counterparts to exhibit hyperactivity and impulsive behaviors, experience more inhibition and cognitive flexibility difficulties, experienced impaired complex attention, show antisocial behaviors, and to receive oppositional defiant disorder or conduct disorder diagnoses, are more strongly associated with schizophrenia, substance use disorders, and hypertension. And then trans individuals with ADHD, this is the initial statistic. So it's very new research because this
Okay.
is some like, but in conclusion, the intersectionality of ADHD, in a sample of 20 cases with gender dysphoria and 40 controls, results show that 90% of the cases with gender dysphoria had at least one psychiatric diagnosis, and ADHD was the leading diagnosis with 75%. Obviously, more evaluations and assessments needs to be done because this
Yeah.
is like a study, but
New studies.
90% with ADHD is pretty significant.
Pretty significant.
Um, and should I go through some of the AD autism crossovers?
Yeah, if you want to.
So females with ADHD or ASD autism. And speaking of autism, there's 3 levels, and maybe we could talk about that at some point. But
I can put that in the chat or the
Yeah.
below.
So they're more likely than their male counterparts to demonstrate social communication skills, but struggle with internalizing symptoms such as anxiety and depression. Display slightly lower restrictive and repetitive behaviors, which is a big marker for autism when you're in the diagnostic process. Have a higher risk of endocrine diseases and congenital malfunctions compared with sex-matched non-autistic counterparts. Show intellectual disabilities, neurological problems, and emotional behavioral challenges. Experience compulsions and or self-injurious behaviors. Have challenges with some inhibition and visual spatial processing. Have higher risks of suicide, particularly among women who are in the average IQ range and have co-occurring ADHD. And have a greater risk of epilepsy and endocrine reproductive problems, depressive disorders, and eating disorders and sleep disorders.
Yeah. Interesting. Eating disorders is pretty high it's a significant for ADHD and autistic men and women to have higher rates of eating disorders. And I know on both sides of my family, eating disorders are an issue. And one side's more ADHD, one side's more autistic. But yeah, I think it's important for you to mention those because, if you're like, oh, maybe do I have one or the other? But like if you see yourself kind of having some of these other categories or comorbidities, it might be something to look into because it could be part of like a bigger pattern.
Yeah, and I think that a lot of finding out about this information was that like, oh,
Yeah.
everything's connected.
Yeah.
We'll do the males with AESD, and they're more likely than their female counterparts to exhibit hyperactivity in childhood, show repetitive motor behaviors and speech. So this is a big thing because this is like if a case comes in as a child or adult without restrictive repetitive behaviors that would kind of mirror like an OCD compulsion, obsession. If an individual doesn't have any markers for restrictive repetitive behaviors, which like females would likely show less,
Yeah.
we often can't give the diagnoses. So this is like
It's
a
a key
big
part of it.
difference in the gender. So they're more likely to show that and have circumscribed interests. So their interests are a little more narrow. Have challenges with cognitive flexibility, autobiographical memory, and have a higher mobility from diseases of the circulatory and nervous system and cancer from external causes.
Yeah. Yeah.
And then I can just briefly talk about trans with ASD.
Oh yeah, that's important to include.
So like you mentioned, like gender identities that don't conform to what they were assigned at birth, we consider them in the realm of psychology, gender dysphoria. And so the co-occurrence of ASD and trans identity is between 15 to 35%, so large range, but it can be up to a third. So that's a pretty significant part of the population.
Yeah.
And so one theory is that because of this, like I mentioned before, they already have disconnection from social norms. It's easier for them to kind of present in a different way than society would expect them to present.
Yeah. Yeah.
Yeah. So there's just like some interesting statistics.
Yeah. A lot of that stuff I didn't know. And because you've done a lot of doctoral level research and it's interesting to learn about. Because it's like before I research into this, you mainly hear about the male presentation of both and like looking into all of these like physical comorbidities and like different types of like, I didn't know about PMDD until I got my diagnosis of ADHD. And I feel like these are all things to assess whether you do it individually or like with a doctor to see, okay, like how can I take care of myself? Because unfortunately, as you mentioned, like suicide rate is higher. Also like accidental death is higher. And then like stress related diseases due to internalized stress is higher. And like medication, you could get medication, but just knowing those things could help you better prepare yourself and live a more full and self-actualized life. Because before I really embraced my diagnoses and be like, okay, like you don't want to over-identify with it either. And that would be a good video, like, how do you like tell people? And for me, I told everyone, and now I tell people, I'm like, oh, it's not something I need to introduce myself
Announce
like
to
when
the
I
world.
first meet
Yeah.
someone, like, maybe get to know them a little bit. But it's like, just being able to be self-aware because yeah, I didn't have a lot of self-awareness before I understood these things about myself.
Mhm.
Right. I'll help you close this out.
Okay, so like we mentioned, like this is our diagnostic process. We've done a video on medication management and what that is like. And we'll continue to share really interesting conversations from people who experience neurodivergency. So, bye.